patient like it. So I create this technique to make the lifting to fulfill the tissue, which is a little bit empty after very quick weight loss. So the entry point will be 1, and I prefer to work with cannula 22 gauge with medium viscoelastic property fillers subdermally. I ask patient to smile. Can you smile, please? Yes. And the apex of the cheek here will be my entry point, because all rays will go on this point. So we will work till the bone structure not go in the real tear trough, but we will stand till the bone structure. After, we will go on the natural triangles, physiological triangles, to the nasolabial. After that, we will support and lift corner of the mouth. After, from the same entry point, we will go to the mandibular angle and to zygoma. So here we will create a perfect apple of the cheek, and also with the lifting lines. Okay, so we will start from this this side, and already I ask patient to smile, not so much like this. And here is our entry point. So the entry point 1, and we will move this. We will move with our cannula. Breathe. Okay. And the cannula is 22 gauge, 70 millimeters. So I have in plan to use 2 cc of filler. Here is 1.2, and with medium elastic properties filler. As we are subdermal, I don't go to the real tear trough, because my goal is to fulfill and to create the apple of the cheek. Because when we have weight loss, the quality of the skin and the emptiness of the skin is visible. So I start to inject, and it's approximately 0.2 on each injections, but it depends on what you need to correct. For example, if you have a nasolabial triangle deeper, so you can inject in nasolabial triangle. So here, before patient has only fulfilling of her tear trough, so here I will make the bolus 0.1 and 0.2 for line retrograde technique. The same, I will go till their corner of the mouth. So I go subdermally and just in the physiological triangles to support corner of the mouth. Also 0.1, 0.1 line retrograde. Now I will go also, because we know that lateral fat pad is very compact, so now I will go laterally and also will give some lifting and support. But my goal is to fulfill a little bit the medial part of the cheek, so to create beautiful apple of the cheek. And the last one, because we know that some masseteric ligaments here, so we going through and till their mandibular angle. And the same, I do 0.1, a little bit more, just to create the structure. And also I have 0.2 in my syringe still, and line retrograde, just very, very gentle, we are fulfilling. So As she has very short zygomatic ligament, from the 18 years old she has here fold. So I would like to perforate it a little bit and to make my filler lying here smoothing. I'm not injecting, I'm just perforating here. It's not very pleasant. Do you feel discomfort? And the same trick, I will go under the mask and also will go perforation on the deeper layer, because here is true ligament, zygomatic ligament. So I perforate it a little bit, and now I will inject the rest of the product, 0.1 here. Okay. And now we will compare what we get. That's one syringe, very smooth result from here.
Danny, can I ask you a quick question? With regards to the cannula size, could you just remind the audience what size you're using?
22 gauge, 70 millimeters. So can you sit down, please? So what we have, can we zoom in? And we see now the perfect cheeks here, very smooth, and especially with zygomatic ligament in this place. Also, patient asked me from the beginning, will we work with nasolabial fold? And can you do like this? From here and from here, we made support. We made support also on the corner of the mouth. We made good projection for the zygomatic line and also to the mandibular angle. Can you smile, please? Because that's also always tricky when patients smile, especially when we do subdermal injections. So I will remind you that it was medium viscoelastic property filler, 1.2 in the syringe. So we have perfect apple of the cheek, very natural result. And that's good for young patients, that's good for boosters, and for medium viscoelastic property fillers. So I'm ready for your questions.
Any questions from the floor? Yes, please.
Thank you. How can you find the